Greetings and a virtual warm welcome to everyone for joining us from the variant concerns of the digital realm. So today we are going to discuss about the topic navigating career pathways in cardiology, a roadmap for MBBS or MD doctors. So over to you, Raji.
Yeah, thank you so much.
Yeah, thank you.
Hi everyone. Myself Raja Rajeshwari, and we are going to have a webinar on the topic of navigating the career pathway in cardiology specialty, a roadmap for both MBBS or MD doctors. So we are going to see how the career pathway will be for cardiology specialty. Okay, so before that, I want to let you know about our university. So we Texila American University, and we have our own campus, which is located in Guyana, which is in South America, and we have it in the Zambia campus too. Where Texila, we offer several health science programs with a high level of professionalism, exactness, and problem-solving skills. So we have a number of courses which our university is dealing and giving a very good career for our students. And our Texila International Marketing Management is our head office, and we deliver a postgraduate program in India in various medical specialties for MBBS and as well as for MD doctors. So our PG medicine courses are very well designed by the top faculties, and we are coupled with advanced training in various disciplines. Upon taking our Texila courses, which we are providing, you can explore your better career opportunities in the medicine or any other healthcare related program and any other courses with our universities. So we have come to a topic is what is cardiology, because we are going to see a specific topic is like navigating the career pathway in cardiology. So I want to let you know what is cardiology. So cardiology means, like everyone doctors, you know, that it's a branch of medicine that really deals with the disease and abnormalities of the heart. And there are three types of cardiology. One will be the invasive cardiology, non-invasive cardiology, and the interventional cardiology. So these are the three types of cardiology techniques. And when it comes with a rising heart disease in people, the demand of the cardiologist in India, it is really getting increased. So many of your colleagues or friends, they would have said about when they search for choosing their career growth. So they will seek towards what type of PG that they want to study, whether they want to do PG internal medicine or PG general surgery, what should do PG dermatology, what I should do really. In that, why a doctor wants to pursue this cardiology specialty, because it is a demanding specialty. Why we say specialty demanding specialties, the reason is increasing the death rate of the peoples and increasing the disease of the peoples. So that deals with the specialty. So when it comes to the cardiology, when you see how we are relating to the patient is, there are really increasing in the cardiovascular diseases, and there is a real increase in the heart disease of the peoples. So we don't have that much cardiologist doctors in India. So that is the reason we say the cardiology is a really demanding specialties. In India, when you see, we have Express report that really says 55 seats in cardiology, and there's 104 seats in cardiovascular and thoracic surgery, were empty out of 1907 seat in super specialty medicines. So you can see how many seat has been left for cardiology specialties. And what are the techniques of cardiology is we have invasive, non-invasive cardiology, interventional, clinical cardiology. So what is invasive? Actually, when you say invasive deals with the surgical, you can like angio or angioplasty, you can the stand to the patients where you'll do a surgery. So in the, if the heart condition is one where the doctors will need to do open up the body and work with minimally invasive surgery for identifying of treating the abnormalities of the heart structure. That is invasive. Invasive completely deal with the surgery part. What is non-invasive cardiology is, if the heart condition is one of that, it does not involve, like you don't want to do any surgery. That is not involved the use of any fluids or needles or other instruments for insertion, for identifying the problem. So that is, we say non-invasive cardiology. What is interventional is, if the heart condition can be fixed by repairing the weakened or damaged vessels and narrowed arteries or such of the part of the body, can be used by catheters, cath labs. Okay, so that towards we deal with the interventional. What is a clinical cardiology? Actually, clinical cardiologist can diagnose, confirm, you can manage the heart disease, and through the 2D echo machines and everything, you can recognize the patient's condition also. So what type of whether they want to do a surgery or whether the patient is okay with the tablets or medicine, that is completely deal with this clinical cardiology. So this is a specialist where you need to develop the symptoms such as angina or abnormal heart rhythm or have a heart attack. So these are the techniques and types of normally the cardiology will be dealing. But in India, we can see normally most of the 80 to 70 percentage of patients will be not dealing with the surgeries. Normally, like if the medicine or without a surgery, if a doctor is recommending them for a medicine or any exercises or anything, they are really ready to do. Only 30 percentage of patients will be dealing with the surgical branches, like angio, based upon the conditions of the patients. So, or the cardiologist in is really high demand? Is there a shortage of cardiologists in India? Because many of them will have a question: is really cardiologist is really high in demand? Yes or no? What about the other specialty? Whether surgery is not a high in demand? Why particularly cardiology? Why it is really in high in demand? Is the real scenario is cardiology in India. It is a medical field which is facing a severe shortage because the reason is we don't have that much cardiologist doctors in India, even in abroad countries. We don't have that much doctors in India. When you see, for example, India, we require 88,000 cardiologist doctors, but the real scenario speaks is we have only 4,000 plus cardiologist doctors, included with consultant interventional cardiologists, cardiac and thoracic surgery doctors, DNB cardiologists. I'm saying including with all the cardiologists, only 4,000 plus doctors all over India we are having, but we need 88,000 cardiologists. So you can see how much lagging is there. But the patient, you can see every day when you see there is a ratio 11 to 12 percentage of people are having heart attack, cardiovascular diseases. They are having the many thing, the patient is really having a scenario and they're facing a severe shortages. So recent data shows the Indian citizen are risk of being affected by heart disease because of their abnormal life work life balances right now. What is happening because they go with a like heating condition is totally different and working professional is totally different, and many of the people are affected in different factors and now they get heart disease and many things. And daily scenario you can see how much patients are going and seeing the doctors, specifically the cardiologist doctors. In certain rural areas, there is no such cardiologist doctor. So what they do is like they go and see normal general physician doctors or some other doctors, and they recommend back to the some other cardiologist. So from one state to the other state, a patient needs to travel to see the cardiologist. In such a situation, the demand for cardiologists is bound to rise. It estimate for heart patient in India stand at 30 million, but cardiology in India is not a very popular field among the medical aspirants. A report by Indian Express has revealed that in current scenario, 55 seats from cardiology and 104 seats in cardiovascular thoracic surgery were empty out of 1907 seats in super specialty medicine. This shows that the future of cardiology in India lies in danger without a cardiologist doctors. So this is especially alarming completely to India. Is a home to the patients, as you know. You are at a high risk of heart disease. This is why we say the demand for cardiologists in India, when one looks at the figure of the patient, is really increasing in the high level of demand. So that is what we recommend the doctors. Okay. So kindly have a knowledge of the cardiology. Just have from the basic to extent, just learn the cardiology, everything, because we really need cardiologist doctors. What is the cardiac situation right now in India is it's the World Health Organization has reported that has esteemed that 29% of total mortality in India are due to cardiovascular disease. And right now it has increased by 7% in the last 5 decades, from 4% to 11%. So that's a sharp rural urban divide, and 20% have a precocious coronary heart disease, CAD, below 40 years. And the main types of orthosclerotic CAD, stroke, and peripheral arterial disease, PAD roughly right now is 6 million cases is added. Over 80% of the world mortality from heart disease occur in low and middle income countries. So you can see like the daily basis how much percentage this cardiovascular disease has been increased in the daily basis of the patients. And you can see roughly 6 million cases has been done with the CAD, stroke, and peripheral heart disease. So this is how the situation is happening in India. So as I told you in one of the presentation, India needs 88,000 plus cardiologists, but we have only 4,000 plus cardiologists. But you can see the patient flows, the cases, particularly cardiovascular cases, heart attack. When you include this, how many all over India you can see millions of cases will be there. But for dealing with the millions of cases, only we have 4,000 plus doctors. You can see whether this much doctors more enough. So at least we need at least 30 to 40% of doctors should be there. Then only we will be able to treat the patients and we can save the patients. 28.1% of death in India are due to the cardiovascular diseases. So in cardiovascular diseases, you can see CAD. 4,000 to 4,500 cases will be there. Ischemic heart diseases, 1,750 to 2,000 cases is there. For stroke, when you see 475 to 550 cases. Rheumatic heart disease, 550 to 670 cases. Okay, so when you see for dealing these particular cases, the ratio of the doctor is only 12 to 12 to just 13 percentage of doctors are there. Is it like within the particular 4,000 plus doctors, how they'll be able to like save these particular cases all over the India? So when it comes in 2020, right now in the scenario 2024, we are. So when it comes in 2025, it will be increasing. It will not be decreasing. If we want to decrease the death rate of the patients, means we need to increase the cardiologist doctors. When we are increasing the cardiologist doctors, automatically the death rate will be decreasing, because many of the patients are not knowing about the hitting habitus and how to take care of themselves and how to treat this particular heart issues. And many of the doctors, when you say, when we are general surgeon, we'll be not able to, even we have our colleagues or friends or our family members who really have an heart attack, okay, at that time. So what a doctor will be doing, if he knows the basic of the cardiology, if he knows like how to like treat him, or if he knows anything about that, to I mean any of the like treadmill testers or something like of medicine or is prescribing, if he knows only, he'll be able to save his own family members. If not, the particular family members will be dead without knowing the cardiology processing and what is that and how, what are the medical reports, what is the medicine to treat. For that, a doctor needs to definitely learn the cardiology programs. A report from Cardiology Society of India has given, in India, the total number of qualified cardiologists is 3,588, as judged from the membership list of the Cardiology Society of India, CSI. There are two cardiac society. One is CSI and Indian College of Cardiology, ICC, and All India Heart Foundation, AIHF. The number of cardiac centers is about 200, and right now it is more and unevenly distributed, mostly in the southern and western part of the country. The northeast part of the country is really poorly served. The training programs in India. So when you see in India, these are the if a doctor wants to become a cardiologist, if they are ready to, okay, I'm going to pursue, I'm going to save my country people, I'm going to learn the cardiology. You can see the total number of seats in India. Aspiring, we know as an MBBS, we pursue our MBBS for 4.5 years, internship for the 12 month, and then after that we try for a NEET PG examination. Current scenario, and then we take our own branches. Many of the doctors have their own dream branches, want to pursue dermatology, internal medicine, surgery, psychiatrist, whatever their dream branch, doctors pursue. In that particular doctors, they want to become a cardiologist. Okay, do you think that they will really become cardiologist? They want to give a NEET PG. They want to score a very good high score level. If they score a very good percentage, of course, definitely you can pursue DNB cardiology. But what about DNB cardiology? Only 72 seats. If a doctor feels, I want to do a DM cardiology, do you know the duration and how to enter into the DM cardiology? Doctors need to pursue their MBBS, crack their NEET PG, pursue MD internal medicine or certain specialties, then give your DM exam, then pursue DM cardiology for 3 years. Then you will become a cardiologist. But you see the age limit, what happens right now in the scenario, when you see many doctors go for abroad and they pursue their MBBS, come to India, finish their FMG clearance. For clearing the FMG itself, they take a long time. After that, they pursue their PG, or certain doctors, they after being a general GP medical officer, they feel they don't want to pursue the PG, they stop it. 10 to 20 percentage of doctors, they stop pursuing their PG. The remaining doctors only, they will pursue their PG in their own dream branch of their specialities. So when it comes with the cardiology, when you see a particular scenario, a doctor finishing their MBBS, then NEET PG, they're trying for 4 times. Okay, so right now you see your age is 22. You completed your MBBS in 22. You have cracked your NEET PG in 25. Okay, and you enrolled for MD internal medicine. You have, as you know, doctors will have certain family situation. I have seen in the current 2024 reports, many doctors have dropped their PG. I think 1,250 doctors have dropped their PG. The current 2024, without pursuing their PG due to certain issues, due to certain hectic works in their respective hospitals, they have dropped out. So they're coming out. So in that, many doctors want to face it. They want to finish their 3 years successfully. They finish their 3 years. What happens? Once we become MD doctors, we start like working that we want to work in that particular field. I want to like open my own hospitals. It takes a 35 age. After that, you do DM exam, and then you do DM cardiology. Before that, we are losing the patients. So total cardiac specialists rolled out every year is 500 approximately. Total number of death in India due to heart problem is 17.3 millions are dying every day. So what is the career path for post MBBS cardiologist in India? So here when you see, as I told you, the fact MBBS 5.5 years, MD 3 years, DM 3 years. If you're finishing perfect time, MBBS, you finish it off. Crack the NEET page in the first attempt. Very good. Done your MD without any dropping out or without extending. You have done it. Finished your MD for 3 years, and then you cracked a DM. Then you finish DM cardiology. Definitely within 11.5 years, you have become a cardiologist, a DM interventional cardiologist. Suppose if it's not happened, what will be happening? 11.5 years, it will move to 16.5 years or 17.5 years. Or other option, doctor skipping to MBBS 5.5 years. I got a very good score in DNB. I got a DNB seat. But DNB, we have only 127 seats in India, all over India. 127, a little bit more. That's it. But we need remaining 4,000 plus cardiologist only is there. But what about the remaining 88,000 minus 4,000? What about the 84,000 plus cardiologists? How we are going to bring it out to secure our patients in India and the peoples? And in the DNB also, the passing ratio is 10 to 15 percentage. So that is the reason we take Silam to save the life and to give the doctors a good career and upgrading of skills and knowledges and to work them as a cardiac specialist, as a clinical cardiologist or non-invasive cardiologist and different designation. We brought the program as clinical cardiology with critical care. Just a 2 years duration. To pursue this clinical cardiology with critical care, no need PG is required. Okay, a doctor being an MBBS or your MD doctor or your diploma in some other specialty, you are eligible to pursue this clinical cardiology. It is completely practical, not like a 6 month online or not like a 3 month practical, not like that. It is completely practical. Hands-on training is very, very, very important in your career progressions. So that is the reason we provide 100% hands-on training. The top renewed hospital under a top DM cardiologist directly or the senior consultant cardiologist directly, the training is held. So they are ready to support you. The particular DM doctor is ready to give you the hands-on trainings. They are really want you to become a cardiologist. Once you become a cardiologist or you're interested to pursue any general surgery, you pursue, no issues. But what we recommend is like whatever specialty you're pursuing, make sure you take one of the branches also cardiology. After having this cardiology, no one is going to say you don't pursue dermatology. After finishing your MBBS, you join cardiology. You finish your 2 years. Okay. While pursuing a cardiology, why don't you try for NEET PG examinations? Because when you pursue this clinical cardiology just for 2 years, you have a degree. You are going to practice as a cardiologist. You can have the clinic, you can save the life in different areas in different state, even in abroad also. The cardiac patient is really increasing. They also don't have that much experienced doctors. They require an experienced who are very very good in their training of hands-on experiences. They are looking, so we can be one of them. So after being a cardiologist, whether you want to, whether suddenly might be right now being MBBS 2022, you cracked your you finish this cardiology. Okay, after 3 years, you cracked your NEET PG. Is very good. After doing your NEET PG, if you want to got MS General, definitely you can finish your MS General seat for 3 years. You can work as a surgeon simultaneously in your own hospital. You can even treat the cardiac patients. You will have both the patients at a time. When you have knowledge of cardiology, you can spread that knowledge of cardiology to even to your colleagues, friends too. That is an advantages which we bring Texila to every doctors all over the countries, and every hospital is ready to support you for the clinical cardiology program. Do you want to know what is the salary of the how much does a cardiologist make? Both in India and abroad, cardiologists can earn in good numbers. In 2018, when you see the average salary for cardiologist ranged between the dollar 3,35,841 to dollar 5,04,458. But you know what is the average salary of cardiologist differs depending on your work experience and the hours once put in the salary ranges. When you're pursuing a cardiologist, it's a trainee. Trainee means when you're pursuing a program, okay? you get a stipend based upon your performance, 40,000 to 50,000. Okay, it's not a salary. When you're training, when you're pursuing PG courses or cardiology in a particular hospital, you are getting a stipend, right? That we call it as trainee. And after finishing your training, and once you become a senior cardiologist, okay, what will be your salary? 1,50,000 to 2,50,000. It will be increasing too. Depends upon your performances. Because if you're very skilled in 2D echo, okay, very skilled in treadmill, and you're very good in handling the patients and you're querying the patients, whatever, you will get a very good job in the top hospitals with our DM cardiologist training, because our DM doctors experience, when you see they are into the cardiology, almost certain doctors 20 to 25 years of experience in that field. Certain doctors 12 to 13 years of experience in that particular field. They would have handled many patients. Okay, so they're very good skilled persons. Under them only you guys are going to be trained. It's a very wonderful opportunity. When you see a doctor being an MBBS, after that, when they do that MD, DM, definitely once a doctor want to pursue DM cardiology, they want to come back to that hospital only or that particular medical colleges for the training under that particular DM doctor. But that opportunity being an MBBS doctor, you are getting directly. So that is a wonderful opportunity for the doctors. The current status of the heart disease in India is alarming, with the projections suggesting that by the year of 2023, the burden of cardiovascular disease in India will suppress that of any country in the world. It is estimated that 9.5 million people die each other in India from cardiovascular diseases, amounting to a staggering of 31% of all death worldwide. 80% of all cardiovascular death are due to the heart attack, stroke. 74% of urban Indians are at the risk of cardiovascular diseases. There are estimated 40 million heart patients in India, out of which 19 million reside in urban areas, 21 million in rural areas. This suggests heart disease are fast becoming an epidemic in rural India. Structured solution is needed for combating the issue. You can see here completely the death rate is increasing at a high level. So we as a doctor, we need to save these patients. For that, we need to have a knowledge of cardiology, all the techniques like non-invasive, interventionals, everything we should learn in order. So that will help even for our family members or neighborhood, or when we run the clinic. Okay, if any patient is coming, for example, if any of us is running a clinic, and if any patient is coming inside, and if they, like if suddenly we found, okay, they're going to have a heart attack, rather than recommending to the other hospitals, we can also treat them, that we can do it. So here is a cardiologist salary, like average of around 35 lakhs to 40 lakhs per year in India. Doctors get this salary because we do have only limited doctors in India. So the hospital is ready to pay a very good salary for our doctors. And cardiologists globally also, you can see $5,33,084 of for cardiac thorax surgeons, one of the highest salary in the survey. And cardiac surgeons earn substantial salaries even at the beginning of their careers. Specialty recruiting from profiles, which works primarily with a new physician, reports median first year salaries of $3,60,000 per year. Why there's a shortage of cardiologists? The main question: why don't we have that much cardiologists in India? We have n number of internal medicine, we have n number of emergency medicine doctors, we can see critical care, we can see any all the department n number of doctors, but cardiology we cannot see that doctor because it's a super specialty. So due to the less number of DM seats, and due to the DNB passing ratio, due to the PG dropout student in the cardiologies, so there are many reasons why there's a shortage of cardiologists in India and as well as in abroad countries. And when it comes PG NEET qualification, NEET page is required to get enrolled for DNB, and as well as for a DM exam, you want to get qualified for MD. And longer period of study, 3 years. MD 3 years, DNB 3 years, and after MD again pursue DM cardiology. It's a long period of study. Low DNB passing rate, 10 to 15 percentage. So these are the reasons for shortage of the cardiologist in India. I'm going to play a testimonial which will be played now.
There is a big demand for cardiologists in India with an estimated 30 million patients at risk of heart diseases. Worldwide cardiologist salaries are between $335,841 and $504,458 range. You can become a cardiologist if you have passed MD or equivalent exam from abroad. The highest level of qualification a cardiologist can attain is a DM in cardiology or an equivalent from abroad. The demand for cardiology seats in India is low and only 395 seats are available countrywide. colleges don't advertise the availability of cardiology seat availability in India. Join fellowship in clinical cardiology with critical care and become super specialist cardiologist. Texila's cardiology specialization programs can make you a great cardiologist. Salient features of Texila include an affordable fee, experience in renowned hospitals. Texila is the right place to become a cardiologist and realize your dream.
So this is our success story of our students who have pursued and graduated this cardiology.
Thank you for the Texila and the whole Texila team, and thank you for our faculty, where I get good quality of education and good.
I think might be this audio will not be listening. So what is coming to say is like, so these are the students, okay, who have been like graduated our cardiology program, and they are really happy in their career with the university because we are increasing the cardiologist doctors from our end. How much support we can do for our like of the patients, and as well as we are bringing a number of cardiologists because all over India we are the universities which we provide a 2 years cardiology program for MBBS and for MD doctors to get specialized in the field of cardiology so that you can practice as a cardiac specialist. And you can also, because it's also a postgraduate program, and you will be getting a very good salary also after completion of the course, a very good designation at the top renewed premium hospitals, a very good hands-on training you'll be getting in the respective hospitals. And simultaneously that will be helping you to run your clinics, and even you can work in urban areas, rural areas, wherever you requires. So when it comes with the, I've shared you like most of the students would have seen in that particular flyers. Okay, do you see like how they experience which they have shared in that particular flyer? Certain doctors would have shared a very good experience, very good hands-on training. He got it. His career path has gone to the next level of his opportunities. Okay, one of the doctors started to work as associate consultant, clinical cardiologist too. So like that, you can also be one of the person. By joining Texila, you can become a cardiac specialist. So that we offer fellowship in clinical cardiology with critical care. And what will be the duration of this program is just 2 years of duration. As I told you, no NEET PG is not required. The duration is 2 years. You'll be pursuing the course in our top premium hospitals in India under a DM or a senior consultant cardiologist with a very good training. Eligibility, you should have done MBBS, completed your internship, registration. Either it can be MCI previously, right now National Medical Commission, or State Medical Council registration. If you have that one, you can really join our cardiology. No age bar. Be Texila, any doctors. Okay, we are ready to recommend you. Why you choose Texila? Like, what is the specific reason? Like, what do you do? Why I want to join in this clinical cardiology? Okay, might be you'll have multiple questions. Okay, fine. I'm after finishing this course, I'm going to become cardiac specialist. Okay, that's good to hear. But why I want to choose this university particularly is we started our cardiology in 2010 period. Okay, and all over India we was a university which we started to provide the cardiology, and we was giving a very good hands-on training, a dedicated student mentor support, a doctors to finish the course within 2 years. So in our university there is no dropout, 99 percentage. Okay, we will make sure that we make the students to finish the course, and then we are making them to graduate. That is what our main motivations. Okay, and after finishing our program, definitely 100% your career will be in the high standard level, because every student who pursued in Texila, they are working right now as a cardiac specialist. And it's very happy to hear that there are certain doctors, once they become a cardiac specialist, they got a MD seat also by cracking the NEET PG. And right now, I think many doctors have finished their MD also. Right now, they're like working in internal medicine department as well as a cardiologist. Okay, so might be there's a question, why, like, after finishing my NEET PG, after finishing my MD, why I cannot do this fellowship? I can do, but the reason I'm saying, after finishing MBBS, join this cardiology. The reason is, once a doctor started to crack your NEET PG, once you finished your MD internal medicine, your mind will be to started to practice, started to work, because of the current scenario world. Okay, we have family members, so dedicatedly we'll be knowing that after being an after, because as you know, with hectic work, many things studying for MD or MS, you're finishing. After that, doing any other PG courses in the regular basis is not possible. 99%, 90 to 95% is not possible, because as being an MD doctors, like there is only 3% of MD doctors we can see to finish in MD. They are doing this 2 years cardiology. Okay, but maximum 99% of MBBS doctors or PG diploma doctors are doing this cardiology for 2 years completely. So after finishing this cardiology, you can pursue any other specialties. And it is completely hospital-based teaching, flexible location, and even the fees is also flexible, because the fees which you're paying, you're getting it back as a stipend. And there's a faculty support from the hospitals and university, a pathway to masters too. What are the hands-on training in the premium hospital? Semester-wise, you'll have a hands-on training. You'll be in cardiology wards, CCU, cardiac ICU emergencies. You'll be into the echocardiographies. You'll be into the stress tests on nuclear imaging, echocardiography in the semester 2. The semester 4, cardiac cath lab and halter, cardiac ICU or emergency, pediatric cardiology. So these are the departments. The doctors will be posted, and there in cardiology, there are different departments. So most of the hospitals will be providing the training, and all the department of the cardiologies. So this is the semester wise of the pattern of departments. Hospitals, when you see, we Texila partnered with these hospitals. 23 hospitals is associated with our universities. You can choose. You have a It's not that what is the university choosing hospital you want to pursue. We give you a choice. You can choose from this any one of hospitals, and you can pursue the course in a preferred location. Okay, and you can complete a 2 years program very successfully. So these hospitals, when you see, the DM or senior consultant cardiologist are very experienced, and most of the hospitals have high bedded capacities also, and they have a technologies. Okay, which is into their hospitals. So you can choose from these any locations, and you can start pursuing. Once the doctors, we have seen like all the doctors has many, most of the doctors from these hospitals have graduated, and right now their career is really good, and they recommend their friends also to join this cardiology program, because when Texila students, when they graduated, if they are referring some colleagues to our Texila, what is the main necessities, what they career growth they have received, they want their colleagues and friends also to receive the same career progression. They don't want to miss this opportunity. What will be the learning and examination pattern is, the method of learning will be, every student will be guided by the program advisors, and student will acquire clinical skills through training in the hospitals, review contaminant articles in concerned specialities. You get a fellowships by submission of your weekly reports, case report, case-based discussions, procedural skills, article reviews, CME and conference certificates. But if a doctor want to, like, instead of the looking for fellowship certificate, if you want a master certificate, then you want to do a thesis with viva voce, because thesis will be guided by your faculty and as well as by our student mentor. So it's a choice for a doctors, and you have a theory plus practical examination. 4 semester pattern means 4 theory examination MCQ based and practical examination in the same hospitals where you're pursuing. And this is our students. Feedback, you can see they give a very good opinion, the education is good, and they have a very good experience with the students and faculties. And Dr. Ramesh Yadav has stated that in TA association with our affiliated hospitals is really good. Okay, in that hospitals. And these are the other testimonials. They given a very good feedback that the student mentor support is really good. I got a best hands-on training, where as being a doctor, the very important is the hands-on training. Okay, the degree is second, but the hands-on training is first. Okay, if a doctor is having just a certificate, but they're not having a hands-on training, no hospitals will be recruiting. Even in our clinic, we'll not be able to handle the patients. So hands-on training is very, very important that we give him with our universities. Advantages of the program can acquire a wider knowledge and exposure, hands-on training in top cardiac hospitals, train in prestigious and premier hospitals of India, a good learning experience with dedicated student mentor and academic coordinator support. You can study anytime, anywhere. This is for theory classes. Apart from a clinical classes and the hands-on training, you'll have a theory classes also through online that we'll be teaching from a Texila academic side, from the DM cardiologist faculties. And you have a dedicated online technical support for the program. You'll be given e-librarian guidance for reference books and articles can be published, and the thesis can be done if a doctor is looking for the pathways for the masters. The benefits for clinical cardiology with critical care program, you'll get a clinical posting certificate from the hospital. It is like you have a 24-month hands-on training. It is like assurance. Okay, because most of the when it comes, it should not be an online, right? Okay, it's a regular program. For that assurance, you get a clinical posting certificate from the hospitals. It's like experience certificate, and after completion of 2 years, you get a fellowship. Okay, and if a doctor is submitting a thesis instead of fellowship, they get to the masters. For that, thesis is mandatory and it is required, and you can easily complete the thesis. That we support. We'll be doing it. So when we came to the final level, so what you are going to do, okay, so this is what like which I'm coming to say is like, if you want to become a cardiac specialist, or if your colleagues or friends if they are searching and looking for a cardiologist, you can really recommend your friends to this Texila. Okay, because once they join our Texila universities, in these affiliated hospitals, he will get a very good training. After finishing the 2 years, he'll be really happy in his career. 100% he'll be really happy. So that even if you want, you can pursue, or if any of your friends or colleagues is interested, you can recommend them also to pursue. And if any of your friends or colleagues looking to pursue the course, you can recommend them to Texila. And even once they have joined, you get a referral bonus, and as well as you'll be getting a good education and a good career too. So thank you for joining with me for this webinar sessions. And if you have any queries, you can let me know through the chat. And if you want to have a talk with me about the program, or about the fees, or about the course, the detailed about the hospitals, you can just note this WhatsApp number. 73977411199, so that on this particular email ID. So right now, as I told you, in India we require many doctors, so that what you can do is like, you can just share my WhatsApp numbers to any of your friends, because as being a doctors, you have a whole contact of doctors. So what you can do is like, you can just share my WhatsApp number or an email ID to the respective your friends or colleagues. So you can just share them, so let them reach to me. So you are really giving a good career not only to the doctors, even we are going to reduce the risk of heart diseases in the patients too. So if you have any queries, you can ask me.
Hope Raji, we have a question in chat. Can you please elaborate it on it?
Sure. So Jay Haran, like you have been asked, like you're an MBBS graduate, and whether this course is recognized by MCI. I'll give a very clear view about this course. As I told you, it's a fellowship. Okay, fellowship in clinical cardiology. Normally, fellowship recognition is not required if a doctor is doing a major specialty, internal medicine like MD, MS, DNB, internal medicine, general surgery, pediatrics, or dermatology. There are many specialty. For that, mandatory national medical or the medical council registration is recommended. When it comes to a cardiology, as I told you, even with Texila, to pursue this clinical cardiology, only MD doctors are recommended, because if a university is giving this type of clinical cardiology, means we have a top accreditations with our universities to pursue this cardiology with the affiliated hospitals. So this, due to the lack of cardiologists in India, and to save the patient, this wonderful clinical cardiology specialty, we are giving directly for an MBBS doctors also. What is the meaning of fellowship is? A fellowship is a doctor is trusted for a hands-on training in that particular cardiology excellence field. To practice as a cardiologist, there is a two difference. You are practicing as a clinical cardiologist, not as an interventional cardiologist. Okay, because clinical cardiologist means you are into the treating the patients through the medicines, TMT reports, echo, that everything you're doing. But you are not doing the surgery, interventionals independently. That is authorized only for the DM doctors. So normally doctors like can do anyone can do fellowship because the fellowship is very popular in India and as well as in abroad countries. Many hospitals giving a fellowship. Why they give a fellowship for an MBBS doctors, MD or DNB doctors? They give a fellowship. The fellowship is brought like a PG diploma level of equaling. Okay, it is like a doctors can have a hands-on training in that particular field so that you can practice as a specialist in that field. Okay, there's two difference. You're not a DM interventional cardiologist, you're clinical cardiologist. Okay, so for you, when it comes with our Texila clinical cardiology course, the recognition is really not required. Okay, normally if you do a fellowship, normally a fellowship means recognition is not required. Not like that. Without recognitions, like you state that you cannot practice, it's not like that. When it comes, like when it, for example, if you're going for Apollo hospitals, or suppose if you're going for Max, or suppose if you're going for any heart institute, okay, if you are showing them the clinical posting letter, or if you're showing them the fellowship in clinical cardiology, what they do is like they make you an appointment in the hospitals, okay, where you'll be working as a cardiac specialist. You'll be appointed in that cardiology department, and there you'll be working as a cardiac specialist, and you'll be working under a DM doctor. That is the one thing. It is like might be in the future you'll be when it comes to the MD doctors, like once they finish their MD, started to work as a professor level, then they go for HOD. Step by step progression is there. But in your career, what will be happening is like once you finish your MBBS, you'll be working as a cardiac specialist under a DM doctors. Okay, because in many of the hospitals, they are really looking for an experienced cardiologist in India. It is like experience. Suppose if you have 2D eco training, you're very smart in the 2D eco treadmill, you're very smart. And even when it comes with a DM doctor, they need a guidance or help for intervention. Even that cath lab or PNG, that also they need a support of you. Because in one of the hospitals and daily when it comes to 2000 cases is coming, if there's only two doctors is able to manage, they'll be not able to manage. They need one of the assistant who have a experienced in the knowledge of cardiology. So they recruit that type of doctors, and the students can practice also, and you're practicing as a clinical cardiologist only, not like a DM cardiologist. So normally you can work in India, so that is not an issue. Cardiology is a super specialty doctor, it's not like a main specialty. Cardiology, when you see DNB cardiology, that is a major. Okay. But as I told you, DM stands for super specialty. So when it comes to the DM cardiology means after finishing their MBBS, MD is the major specialty. The main specialty is the MD. Okay. After finishing the MD main specialty only, they will do the super specialty, which is DM cardiology. So that much extension is there for because a DM doctor study both interventional, non-interventional, clinical, non-invasive, everything they study. That is what we call them as a DM cardiologist. Okay. But you study a fellowship in clinical cardiology. In that, one of the department you're studying is the only clinical cardiology. Okay, so for you there is no risk, and I think hope you'd have for you to give an example. There are many doctors will pursue fellowship in emergency medicine. Do you think the fellowship in emergency medicine or certain fellowship in neurosurgery is recognized? Even many MD doctors will pursue. MD doctors would have pursued, PG diploma would have pursued, or maybe your colleagues also would have pursued a fellowship courses or diploma courses. Okay, or they would have pursued many courses they would have pursued. Check with them whether these courses are recognized or they were registered in National Medical Council and why they want to pursue that type of courses. For that type of courses, recognition is not at all required. It is like that type of fellowship one of the hospital is providing. They are ready to teach you the department of cardiology department of 24 months, like a work experience. They're ready to teach you. They're ready to teach you in that department, and you get a very good hands-on training and you get excellence in the cardiology field so that you are after finishing this fellowship with one part of the PG certificate, you're practicing as a cardiac specialist. As a clinical cardiologist, you're supporting to the hospitals and you're running the clinics. Sure. Like how you guys like you're stating that how we are choosing the hospitals for tie-up. It is only based upon our there is one board of directors and with the cardiology. So they are only choosing the hospitals. It's based upon the bedded. Okay, how much bedded capacity is there and how based upon the training is given by the hospitals. Based upon that only we are like proceeding for the tie-up of the hospitals. Okay, so when it comes with the typing is like normally doctor, because as I told you, the affiliated hospital which I am sharing you. Okay, in these particular hospital, every hospital really good. Okay, not only these hospitals, are many hospitals ready to tie up with us because they want to teach you. Every hospital tie up is only based upon the beddeds, how much bedded, whether the hands-on training is given, and the students are flexible there, and the faculty is teaching them. Okay, so due to that only the tie up has been given. for the hospital associations. And do you have any other questions apart from this? Definitely, doctor. Like students normally, like after completion of the course, okay, as I told you in one of the presentations, advantages also is there. Like once suppose if you're pursuing one of the affiliated hospitals, if the HOD or the DM or the coordinators or the hospital like your performance, okay, they say, okay, your performance is really good, because normally as a doctor, you know, like when we are dealing with the patients, the HOD will be monitoring you, the DM doctors will be monitoring you. So when your performance is really good, they will be giving the job also in the same particular hospitals. That's only based upon your performance and additional responsibilities. You can continue. Even after finishing 2 years, also you can continue. Definitely, doctor. Residency as a cardiologist is like senior resident. Our doctors, when you see after finishing this cardiology, they're working in different designations. Okay, certain doctors work as a senior resident cardiologist. They work in this designation. Certain doctors work as a clinical cardiologist, non-invasive cardiologist designation they practice. Okay, so these are the designation I've seen in many of the hospitals doctors are practicing. Okay, so as I told you, you can work as a cardiologist. So there's a two difference I told you. DM, that is totally different. So you'll be not practicing as like a DM, because DM is interventional. You'll be practicing as like a senior resident cardiologist or a like of clinical cardiologist or a non-invasive cardiologist. Okay, so these particular designations you'll be practicing. Of course, doctor. Like, if you want to like know more details about this course, to have individual discussion also, you can contact me to the given WhatsApp. Okay, so that also about apart from this, if you have any questions, but currently if you're not able to have a talk, also no issues. You can reach me to that particular WhatsApp number. I can give you with all the details. I can give you with all the supports also. And so thank you for the session. And thank you, Kalai,
Uh,
for
thank you,
organizing
Raju.
this webinar. So thank you. Thank you, everyone.
Now, a virtual big thank you to everyone for joining us from the various concerns of the digital realm. So, looking forward to connect with you again in the virtual space. Thank you so much for the participation and your patience. Thank you very much.